Welcome to The Explainer. So if you're the kind of person who loves to understand exactly how things work beneath the surface, you are definitely in the right place. Today, we're going to uncover a hidden biological mechanism. We're looking at exactly how life-saving chronic medications interact with our underlying nutritional needs. It's kind of like a giant puzzle of cellular biology, and we're going to put the pieces together right now.
Are your medications actually stealing your nutrients? I know, it sounds a bit dramatic, right? But seriously, consider this. Have you, or maybe a loved one, ever experienced unexplainable symptoms? I'm talking sudden brain fog, persistent fatigue, or just random muscle cramps. Even though your underlying chronic diseases are perfectly managed by your doctor, you do everything right, you take your meds on time, and yet, something still feels off. Well, today, we're going to validate those exact symptoms by diving into the science. So, the crucial point we really need to anchor on is this. Medications hijack metabolic pathways slowly. Depletion is cumulative, not immediate. We aren't talking about some allergic reaction that happens 20 minutes after taking a pill. No, we are talking about a stealthy, gradual loss of essential vitamins and minerals. It's something that builds up over months or literally even years of daily medication use.
Okay, here's our roadmap for this explainer, so we can make sense of all this together. 1. The hidden cost of healing. 2. How drugs hijack nutrients. 3. The usual suspects. 4. The depletion spectrum. And finally, number 5, bridging the care gap.
All right, let's jump right into part 1, the hidden cost of healing.
Now, I want to be absolutely clear right out of the gate. Chronic medications are modern miracles, and nobody should stop their prescribed treatments. But there is a clinical imperative here. The primary goal is the prevention of deficiency. We really want to proactively identify subclinical depletions to optimize outcomes and reduce adverse effects. The objective is never to stop the essential treatment. Instead, we want to smartly support the body. That way, long-term complications aren't falsely blamed on the underlying disease when, in reality, they're just a side effect of a totally fixable nutrient gap.
Okay, let's dive into this next section. Part 2. How drugs hijack nutrients. So, there are actually 6 distinct ways drugs act as overzealous hijackers in our system. Sometimes it starts right at the top, like appetite suppression or an altered sense of taste, which simply reduces how many nutrients you take in. Moving down the digestive tract, drugs can alter gastrointestinal absorption by changing the stomach's pH or just how fast food moves through you. Or they might cause direct malabsorption by literally chemically binding to nutrients right there in the gut. Once inside the body, drugs can alter metabolism by disrupting the enzymes we need to convert nutrients into their active forms. They can forcibly increase metabolic utilization, basically burning through our reserves. And finally, they can act on the kidneys, increasing urinary losses by changing how our body reabsorbs essential electrolytes.
And this brilliantly illustrates the sheer diversity of these mechanisms. Let's compare a GI disruptor to a renal disruptor. Take metformin. It's an incredible drug for diabetes, but it essentially acts like a bouncer in your gut, interfering with the receptors needed to absorb vitamin B12. Compare that to diuretics. They bypass the gut entirely, go straight to the kidneys, and force rapid electrolyte wasting. They are literally flushing vital magnesium and potassium right down the drain. So you've got 2 completely different pathways that result in the exact same fundamental problem, cellular depletion.
Moving right along to part 3, the usual suspects. Let's interrogate these high-risk meds.
Looking at this clinical cheat sheet, an undeniable pattern of depletions starts to emerge, and it's caused by some of the most heavily prescribed drugs in the world. The culprits driving down vitamin B12, magnesium, and calcium, well, they're hiding in plain sight. We're talking proton pump inhibitors for heartburn, metformin for blood sugar, loop diuretics for blood pressure, and statins for cholesterol.
Let's break down these usual suspects a bit more. Statins, which are taken by millions to lower cholesterol, simultaneously halt the body's ability to naturally produce coenzyme Q10, and that's a critical molecule for cellular energy and muscle health. Then you have antacids and proton pump inhibitors. They purposefully and drastically lower stomach acid to heal ulcers and stop acid reflux. But guess what? That same acid is absolutely mandatory for unlocking vitamin B12 from our food and preparing magnesium for absorption. And loop diuretics? They're essential for managing heart failure and high blood pressure, but they essentially open the floodgates in the kidneys, accidentally robbing the body of crucial calcium and magnesium in the process.
Now, we absolutely have to highlight the compound structural threat posed by corticosteroids like prednisone. These hit the body with a triple threat. They alter vitamin D metabolism, they reduce GI absorption of calcium, and they increase renal excretion of calcium.
This rapidly accelerates bone demineralization. It creates this really aggressive need for preventative supplementation just to dodge long-term devastating conditions like osteoporosis.
Let's move to Part 4 and see how this all builds. Part 4, the depletion spectrum.
Okay, looking at how this progresses, in stage 1 we see subclinical early symptoms. Think generalized weakness, mild cognitive fog, maybe some muscle cramps. The real tragedy here is that these are way too often falsely dismissed as just normal aging or basic side effects of a disease. If those are ignored, the patient drifts right into stage 2, asymptomatic laboratory abnormalities, where blood markers actually start dropping. Eventually they hit the red zone. Stage 3, advanced deficiency syndromes. Now we're talking peripheral neuropathy, severe myopathy, or cardiac arrhythmias, things that permanently affect a person's quality of life.
The creepy nature of this threat is honestly undeniable. Look at the timeline. After a few weeks on a new drug, the patient feels fine. Nutrient stores are completely normal. But by months in, those subclinical symptoms like fatigue begin to whisper. Perhaps a year or more later, routine lab work starts showing borderline critical drops. And over the long term, severe complications manifest. This timeline proves exactly why waiting around for severe symptoms to appear is just a losing game.
Let's pivot to the solutions. Part 5, Bridging the Care Gap.
Now what's really interesting about this slide is seeing how we mitigate these risks in the real world. Allied healthcare professionals use an exact, proactive 4-step protocol. Step 1 is to proactively screen medication profiles for those high-risk drugs. Step 2 is to counsel the patient, educating them on the drug's mechanism and validating their symptoms. Step 3 is to advise and support with individualized dietary modifications or targeted supplementation. And finally, Step 4 is to monitor those interventions and refer back to the primary care provider if advanced syndromes are suspected. It's a really elegant protective safety net. And when we say targeted supplementation, we mean specific, actionable dosages straight from the clinical evidence guidelines. For example, to replete a patient facing depletion from chronic metformin therapy, the guidelines suggests a daily dose of up to 1,000 micrograms of vitamin B12. Contrast that with someone on long-term statin therapy. They might require up to 200 milligrams per day of coenzyme Q10 to mitigate statin-related muscle side effects. You see, it's not about just taking random multivitamins. It's about precise, strategic replenishment based on the specific drug class.
So to summarize our core takeaways for today. Number 1, depletion is cumulative, not immediate. It happens slowly, which means we actually have a window to proactively screen for it. Number 2, individualize the intervention. Evidence-based supplementation must account for a patient's unique history and lab findings. And number 3, managing nutrient depletion directly optimizes the primary treatment outcome. Basically, addressing these hidden depletions profoundly improves overall chronic disease management.
As we wrap up, I want to leave you with this powerful, provocative thought. Will you simply treat the disease, or will you optimize the patient? Understanding drug-induced nutrient depletion shifts you from being a passive recipient of medical care to an empowered, informed participant. Armed with this knowledge, you are now equipped to have a meaningful, targeted discussion about nutritional support with your own healthcare provider. Thank you for learning with me today on The Explainer. Stay curious and keep digging beneath the surface.